Admittedly, after the win and the cash prize, been swimming in guilt from the minute I capsized. Sticking in the river where I didn't get baptized. Mistakes happen and I figured that that's life.
Just take it inside and sit down.
Dan's from the country, but tonight he's in a city that never sleeps.
Really, how many people are still out for it?
Probably that. Sounds like it's hit the fan.
I can't believe it. Today's my first day as an ambulance officer. Pretty excited. I didn't get a lot of sleep last night. I was up most of the night, just tossing and turning, a bit nervous.
The job is already in Dan's blood. His mother is a nurse, and his father has been a paramedic for 30 years.
Ever since he was a small child, he was been a very caring sort of kid, and when he decided, and it was his decision, it really was, he come up one day and said, you know, I'd like to do your job, Dad.
Sabina, for 31 years, you have to have a lot of patience and you have to care a lot about your job. It makes him pretty proud. I know that he's been able to do it for so long, and I hope I can do it as well.
You get yourself familiar with these things.
Yep.
Dan's partner is Amy, a 7-year paramedic veteran who's mentored scores of trainees.
This job is a really steep learning curve. It takes about 3 years to become fully qualified, and there are 2 distinct stages where it's really quite difficult. And the first one is being brand new.
Ambulance emergency, tell me exactly what's happened.
There's a guy laying on the ground in the middle of the road. I believe he's been hit by a car.
Dan's en route to his first major accident. There's been a hit and run on one of Sydney's busiest roads.
Actually, there's a male who's breathing. It's unknown. All are not on scene. I had fears going to a major trauma that I'd walk out of the car and I'd just go blank. When we drive past and there's someone just lying motionless in the middle of the road, you think the worst.
It's raining. They're in the middle of the street. We want to collar them on the bed, get them in the car.
Witnesses say the 25-year-old victim was struck by the first car, then a second car ran right over him. Both drivers kept going.
My name's Amy and Dan is here as well. We're paramedics. I'll tell you how it happened. You were walking, were you, mate? Yeah. Walking along the road.
Where have you got pain? In here.
Where else?
I could see from looking at him, he's obviously hit something with his head, and he had blood coming out of his mouth. So he's had a whole bunch of alcohol tonight. He could have head injury, he could have a spinal injury, he could have a bunch of injuries.
Dan and Amy's immediate concern is to stabilise Jordan's spine before they move him.
We've got to leave him lying.
I swear to God. Take it off. I can't breathe.
Okay.
Take it off.
Okay.
Take it off.
We're going to look after you, Jordan.
Although painful, the collar is crucial paramedic care.
1, 2, 3. Worst case scenario is if he moves his neck in a certain way, if he has got injuries in the back of his neck, it could kill him very quickly.
Climb over.
With a major trauma, when you're still pretty new in the job, even the basics can go out the window. You get a bit flustered and, not sure what to do.
I just need to take your blood pressure on this arm, mate.
Dan was really good. He just started to do everything himself, and he just gets in and does it.
We're at hospital now, okay? So we're going to get you in there and get seen as soon as possible, okay?
I'll give you choking. I can't breathe.
I know.
I can't breathe if you just move my
You'll be right, Jordan. Just hold on for us.
That's my first major trauma. For me, that job felt like it only went for a few minutes, but it went for quite a while. The fact that they didn't stop is quite disturbing, I suppose. Who wouldn't stop when you hit someone? Of course you're going to stop. The fact you can stop, pull over, see how severe it is, and render assistance if you can, could save his life.
The double hit and run left Jordan with a fractured rib and shoulder, bruised heart, collapsed lungs, and brain injuries. Police are still searching for both drivers. At college, 50 students have just started their journey to become paramedics.
We're on the way. Woo!
They'll have to make it through college, then 3 years on-road training to become fully qualified paramedics.
Tom, I'm Ray from the ambulance service, and this is Blake.
Oh,
how you going, mate? Here to help you today. What's happened?
Car hit me.
Car hit you? Okay, just 1 sec. I'm just going to take some observations.
Today's lesson is Paramedic 101. how to assess a patient.
Anyone who calls 000 will need to undergo a patient assessment. It is arguably our most important skill.
Can you get me a pedal pulse?
Yep, not a worry. His BP's 120 on 70.
Former fireman Rayner is paired up with former lifesaver Blake Field.
One of the hardest things for me is going to be adapting from wearing a pair of board shorts and a polo shirt with no shoes to wearing a business shirt, pants, socks and a big pair of boots. Pretty suave, minus the shoes. That's the way I like it.
Okay, Blake, what's his odds?
Well, I don't know whether it's too noisy or whether I was just doing it in the wrong spot, but I just couldn't hear anything. I thought it might have been noise in the room.
But noise isn't the problem. Blake has made a basic mistake.
Was it on the wrong hole? My stethoscope was on the wrong settings, and I might as well have been putting my ear up to his chest.
Misusing a stethoscope is one thing. The two rookies have made a far more dangerous error.
We didn't do any spinal management. We didn't support his head. So, yeah, that's pretty crucial thing to miss.
If this was for real, Rayner and Blake could have just made their patient a paraplegic. Mistakes like these could cost them their careers.
They really need to concentrate. With the observation skills, if they're not getting those, there's a chance that they may not go out on road.
But being a paramedic requires much more than advanced clinical knowledge.
To be a paramedic, you have to love people. You have to love dealing with all different sorts. You have to be prepared to accept anyone and everyone and accept the beauty and the diversity of human beings because you see everyone. You really see everyone.
It's 8 p.m. in Sydney's King's Cross.
Just look out for a cop car, mate.
A man has called 000, saying he's been forced to swallow a snake. 25-year-old trainee John is heading into the unknown.
Oh, there's the cop car. Good to be arrested. It's quite a lot of cops here at the moment, and apparently we've got a male patient of unknown age who's got some sort of acute mental health problems, so we're going to go over and suss it out.
Yeah.
It's John's first encounter with a psychotic patient.
Yeah. I've never seen someone with this kind of level of psychosis. He seems pretty out of control.
Yeah.
A man believes he's just been forced to swallow a snake.
He believes someone's poisoned him and put a snake inside him, so he's obviously quite delusional and sort of quite detached from reality.
Police restrain the man so paramedics can safely treat him.
Oh, good.
It's the first psychotic attack trainee John has ever seen.
To see someone in that kind of state, it's a pretty confronting image. There's probably a number of factors that have led him to be like that. It probably hasn't just happened overnight.
Don't. I knew I was right.
Mate, we're just going to give you something that's going to make you feel a bit more relaxed, OK?
There's quite a bit going on in that scene. There's quite a few people there, the patient and police as well, so I was just trying to kind of find my place within all that.
I was just going to have 5 milligrams of midazolam, which is like Valium.
Yeah, no resource.
Just nice and relaxed with that arm, pal. It's all right. You're all right. You're OK. That's all, mate. Mate, have you had any drugs tonight at all? Have you had any ice or anything?
Pulse 140, Sats 97.
With the man's pulse double what it would be at rest, Jordan suspects the psychosis has been triggered by something else.
He perhaps could have taken ice. His heart rate's very high, or perhaps speed or something like that, some sort of stimulant. He denies taking anything, but it could just be associated with his acute psychosis.
The man urgently needs high-level psychiatric care.
I'm just putting a strap on your arm, OK? All this is so that we can transport you to hospital safely, because you're pretty upset by what's going on tonight. The methods we use are about preserving the patient's dignity as much as possible. All right, mate, lie flat on here. We could have had him handcuffed and put him in the back of the ambulance with 4 coppers holding him down, but that's not very dignified. It doesn't really serve him well or his current condition. A few bumps, mate.
I've never seen someone with this kind of level of psychosis. He seems pretty out of control, so...
get him up to hospital.
30% of all paramedic call-outs involve some form of mental illness.
Are you on any regular medicines?
Carrots.
Carrots? And what else?
Broccoli.
Broccoli, what else? By the sounds of things, he's probably not compliant with his medications, and that's more than likely that tonight's sort of psychotic episode was a consequence of that.
I've learnt from that situation just to keep calm. I mean, there's no point kind of getting all worked up and panicking, and just being able to keep a straight head and do your job properly, I suppose, and not let it kind of play too much on your mind.
We talked a little bit the last couple of days about some violent situations and aggressive situations you get into.
At Paramedic College, dealing with uncooperative, drug or alcohol-affected patients was core training for John and former vet assistant Jenna.
You will become experts in people's body language very, very fast. OK, and your training officers, your mentors, will be able to pick up quite quickly whether people are agitated and upset.
Jenna's now on the road as a trainee paramedic in Sydney's West.
Traditionally around here it can get quite wild, quite hairy.
She's teamed up with mentor Cleone on one of the biggest shifts of the year, New Year's Eve.
We're likely to have some assaults, you're going to see some bleeding, you're going to have a lot of vomiting, I reckon. You need to keep your wits about you, keep your eyes open, keep the eyes in the back of your head open.
I'm pretty excited, actually, to get to see what happens behind the scenes, but at the same time, a little bit worried about, you know, violence and alcohol intoxication.
10:30. Jenna and Cleone are called to an assault.
Quick coffee away.
Where are we going?
Someone's been glassed.
I'm a little bit nervous with this job. I've only been on road for about a week. The situation, even though it's calm when you get there, can flare up, you know, within a second.
They're walking into the aftermath of a street party that turned into an alcohol-fueled brawl.
Hi, mate.
I'm good.
Do you want to just come over here so we can just have a look at you?
I'm having a smoke.
We'll put your smoke out and we'll have a look.
32-year-old Jay has been left with a severely gashed nose.
What happened was it actually involved my 9-year-old son, and he was actually fighting with a boy around the corner. And of course the adults have bridged up at that, and that's when the man across the road actually got glassed. And I can't believe, you know, just friction between two 9-year-olds would cause adults to come around here and start with the rest of the adults.
I broke out of it.
Really silly.
Looks pretty nasty.
Yeah, it's a glass bottle. Some idiot just come around here threatening all of us.
Did they hit you on the head with it, or was it already smashed?
Straight there. It was already broken.
How much have you had to drink?
2 Jack Daniels and about 6 beers. So, all I need is a few stitches. I can do that.
Mate, half your nose is hanging off. It's down to the bone.
I just need a stitches.
No.
Yeah.
I was a little bit shocked at the laceration on his nose. You could literally see inside the nasal cavity.
No idea.
But Jenna and Cleone face a problem. Jay doesn't believe his injury is severe enough to get medical attention.
Mate, you need to come to hospital.
No, I don't.
Yes, you do.
No, I don't. I've had worse than that. You've got no idea.
It's a nasty wound. It needs to be looked at. I can't leave you here. There's potential for you to get an infection and it can go to your brain.
I'm not going. You can't make me go.
Yes, we can.
No, you can't. You can't arrest me over it. I've got first aid kit there. I can screw it and stitch it.
New Year's Eve in Western Sydney. Jay's had a bottle smashed into his face, but refuses to go to hospital.
The wound was caused by a bottle to the face, from what we know, so it's not exactly sterile, and he definitely needs to get treatment. Could get an infection which can go up to his brain.
If Jay doesn't go to hospital, there's a significant risk to his health.
I can't leave you here, mate. It's going to get a nasty infection.
Even if I have to come with you, I'll come.
Paramedics, police and friends all have the same message.
Let's go. He's going to go. Because it's a horrible cut.
We're going to be hurried up then.
Well, let's go.
I was really impressed with Cleone, the way she handled that situation. He'd been drinking. He could have got violent for all we know. So she was really forward and really direct and, you know, convinced him to come in the nicest way possible. Rock and roll.
I'll be back. Make sure them beers are cold.
Looks pretty nasty, though.
Well, that I seen it in the mirror. I thought, holy shit. I don't care. I don't give a shit. You only live once, so you might want good fun.
While waiting in casualty, Jay discovers his remodelled nose is a novel New Year's Eve party trick.
Stop poking at it.
What does it piss out there?
Oh, my God.
Oh. He started playing with it inside and kind of folding it over, and we were trying to tell him not to do that because it makes it bleed more, it makes it worse. He was just quite happy to gross us out, and he thought it was quite funny just to kind of take the top half of his nose off. So hopefully it won't be a Michael Jackson issue with that one, I don't
know. In Sydney City, trainee Dan and his mentor Amy have just returned from a hit and run. Now, country boy Dan heads into Sydney's notorious King's Cross for the very first time.
Never been on that side of the city at all, even when I'm not in this blue uniform. I've been told about it plenty of times, but that's the first time I've actually witnessed it myself.
It's Drag for a Dollar night at the Arc nightclub. Dancer Leonardo DiCaprio has fallen and damaged a knee.
What's happened? One of our performers, she took a bit of a tumble. There's a guy there who says he's a nurse and he reckons she's dislocated her knee.
The nightclub is behind closed doors next to an adult shop, a long way from country New South Wales.
Country boy, basically. Never really been to city that much, so yeah. Amy warned me that this side of town is sometimes a little bit strange from our behalf, I suppose. Maybe not strange to other people, but for me.
So we knew it was going to be interesting to start with when we're walking down the back entrance to the club, and there's lots of people standing around, and we had to walk through them all.
Walked in there, there's either male or female dancers. I wasn't real sure. Had to double take a couple of times, going, I'm not sure there, still not sure.
Taking a tumble.
Yeah.
I wasn't going to ask, so I waited for someone to tell me. I said, is our patient all right? And yes, she's okay. She's had a fall after dancing and hurt her right knee, so take her to hospital.
You can sit in the front.
Okay. Dan's role is to monitor and assess Leonardo on her way to hospital.
How's that pain now that you stop moving around?
This feels amazing.
It's good stuff, isn't it?
The green whistle provides immediate pain relief with interesting side effects.
The best show of my life.
Just explain to me again, because I couldn't really hear that much of that.
Kind of did like a pelvic movement to the right, and then as I did that, my knee just gave way. Whoever was standing behind me got a nice view of my butt.
Nice. She did do it.
Apparently, as of the 1st of the 12th, 2012, the astrological signs are going to change because the star alignment is different. But apparently, the 21st of the 12th, 2012, we're all going to die anyway. So, who cares?
She was stable, so that was good on our side of things, but there was some pretty loopy conversations in the back there. I'd just go along with it, and it was quite funny, I suppose.
Do you reckon the ice has done anything for you?
I think this little green friend of mine has.
That's done the trick?
Leonardo only suffered minor ligament damage, but one issue needed closer examination.
Apparently, your signs are all changing next year, and no idea exactly what happens. Do you stay the same one that you were born with, or do you change over? I don't know. Home time.
I'm buggered.
Yeah.
For Dan and Amy, John and Jordan, Jenna and Cleone, night shift is over.
Pretty seedy feeling, watching the sun come up after, you haven't had any sleep the night before.
Soldier. Congratulations on your first new year. Many more to come.
Oh, yes. It's different when you're on the front line, I guess. It was very different for me tonight.
Next time on Recruits.
1, 2, 3.
John's first car crash.
We've got oxygen on him. How's his colour looking now, John?
How are you feeling, Ellen?
Rebecca attends a tricky domestic situation.
She must have really given him a good old heap to get him out of bed.
And Jenna's worst fear.
It's something I'll never forget. I've never felt like that before.
And for more recruits action, log on to the website.